Bruce Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me this afternoon. Hello.
Hello, ma'am.
Oh boy. Let's unpack some of the numbers from the weekend, can you?
Sure. So we've still seen a pretty significant rise in the number of COVID cases day by day. We've hit a new one-day record multiple times this week, or I'm sorry, over the last 7 days, with a peak of 262 on the 6th. Today, our numbers are down quite a bit. They're down to 171, but I'm not holding on to that number and thinking that we're truly through the worst of it yet. I think we still have a ways to go. I think there could be a myriad of reasons that it's short today.
So you got some fresh information from the State Department of Health today that kind of helps us break down and understand where a lot of those new cases are coming from. And I think people would be surprised to know that it's not necessarily from large gatherings like it was back earlier this summer.
Sure. So we did get some information from State Department of Health. They were gracious enough to unpack some of the contact tracing information they collect when folks do pick up the call or pick up the phone when they call and discuss where they've been, what they were doing, and that kind of background information. And one thing we found is that number one, people need to pick up the phone. Not a lot of the people they reached out to were picked up the phone and answered their questions and things like that. And so one thing we found is a lot of people tested positive that had been out of state for fall, we presume for fall break. We look at the dates that they provided us with what was going on in our county where these instances occurred, and it's a pretty good correlation that these happened during fall break. Folks either got sick in this other location and came back, or they got sick when they came back from that destination. So, especially this time of year with the upcoming travel, again, we've got to think about who we're giving it to or who might be giving it to us and really assess if it's worth jeopardizing yourself, jeopardizing your family members, and ultimately jeopardizing the community as well to travel and get together for those holidays.
I think if a lot of us are being honest with ourselves, truly honest with ourselves, we do a fantastic job of wearing our masks when we're out in public, when we're going to the grocery store, to the restaurant. Kids are wearing them at school. So that's not where we're finding that COVID is being transmitted, though. It's in the private residences of most of our residents.
That's correct. We see what the schools are doing. Schools are having some issues. Hamilton Heights are having some issues with having to go to hybrid model. Part of that is due to quarantining so many people that are close contacts, more so than the number of cases. We do look at where people are contracting them from. They are household members, they are friends, they are family members that are not in their immediate household. Those are the top 3 places or top 3 associations where folks are contracting COVID from.
So, which leads us to the obvious question. Thanksgiving's just a few weeks away now. What is the Center for Disease Control saying at this point as to whether or not you should even celebrate the holiday?
So the CDC is highly recommending to do virtual celebrations and to utilize some of these technologies that we have, like Microsoft Teams or Zoom or some of the other software available out there to check in with your family members and to have the holidays together that way. They do say that if you are going to meet, that you should use the largest space you have and to separate everybody out as much as possible. Multiple tables, wearing your mask when you're not physically eating to help prevent the spread of it. Things like that to help safeguard yourself and your family or your friends, whoever you're spending the holidays with. But ultimately, the best way to limit the spread is by not traveling and keeping to your household this year, as much as painful as that is.
Well, and that all sounds well and good, but there are many households who are going to be receiving home some college kids who have been out of the house for months. What is the recommendation for acclimating a 20-something back into your household here in the coming weeks?
Well, I would hope that the discussion would begin before they come home to, practice, uh, techniques that are going to safeguard themselves, wearing their masks, staying away from folks that are ill, washing their hands, no undue social events. Depending upon the age, alcohol may be an issue, and alcohol reduces our inhibitions and doesn't necessarily lead to the best life choices. That maybe we need to stay away from some of the partying on campus or wherever prior to heading home. And ultimately, if that young person becomes ill, we're going to have to quarantine them at home or isolate them at home away from the rest of the family as well. So there are definitely some consequences to the children or the young adults coming home from universities.
Yeah, an interesting statistic when Dr. Burks brought it up a couple weeks ago that are these 20 somethings could be 80% asymptomatic. So they may not even exhibit symptoms. Is it good to quarantine them just when they get home for 10 days?
Well, I don't think it would hurt. Don't know of many 20-year-olds that are gonna
Right.
stick around idly for 10 days without seeing their friends that they haven't seen for a semester or longer. But that's part of the discussions that we need to have with our family members, is the larger impacts of their decisions and how, a decision that Tammy makes today is going to affect her family for the next 10 to 14 days. So we need to be making those good decisions all along here, especially moving into the holidays.
Oh, the holidays are stressful enough without all of this going on. Talk to me about mental health, because I think we can all agree we've had it.
Yes. Yeah. So, the big buzzword that's been going around the last week or so is COVID fatigue. And, we're all sick of dealing with this. We've been dealing with this for going on 10 months now. It seems like it's been going on for a decade, but it is dragging on, and it seems like it's going to continue to drag on until people start taking some more accountability of themselves. But, we also we're heading into the holidays, which is traditionally a time when we see an increase in suicides and other mental health issues as well. And we also add in seasonal affective disorder, or SAD, when physiologically some bodies are not adapted for the winter months, and there are treatment methods for it, but you need to be able to identify that, and seek medical treatment for that as well. So there's a number of things that are playing into mental health issues right now, and we just want to make sure that everyone's aware and checking in on their families, their friends, their loved ones, and if people need help, to seek help. There is no shame in going to get help and asking for help in this. And we have many resources here in the county and in the state that are here to help folks throughout.
Great. Chris, anything else you want to add? I didn't ask. Or any thoughts as we move into the week ahead and inch ever closer to Thanksgiving?
Well, I think we need to discuss that. Yes, the holidays are coming up. Yes, we miss our families. We want to spend time together. But ultimately, these individual decisions like wearing your masks and avoiding these private gatherings are what are ultimately going to keep the schools and the economy open. And, we all have to play our part to keep this train moving and keep it moving, get it moving back in the right direction. And, it's the government does not want to dictate what we do. We need the individuals to step up, take some personal accountability, and recognize that it takes the entire team here to have the positive outcome we're all looking for.
Great. Chris, thank you again. Chris is the Emergency Preparedness Coordinator at the Hamilton County Health Department. We'll check in with you again next week.
Thanks, ma'am.